now we will proceed for the next lecture. I would like to invite Dr. Mohan Pawar, Professor and Head, Department of FMT, Pravara Institute of Medical Sciences, Loni. Then he will speak on medical certification of cause of death, parts, types, and filling up. Dr. Mohan Pawar, I want to introduce him, and it's my pleasure. Dr. Mohan Pawar, at present, working in Pravara Institute of Medical Sciences, Lodi, as a professor and head, Department of Forensic Medicine and Toxicology. He is qualified as MD Forensic and has completed his LLB also. He has been medical superintendent at Rural Hospital in 1999. He also has worked in various private and government institutions as head of the department. He has teaching experience of 17 years in the forensic medicine and toxicology. He has presented 5 oral papers to different conferences, and he has received the Best Paper Award in the conference at JNMC Belgaum. His 10 research articles are published in national journals and 7 are published in international journals. He remained organizing secretary of Forensic Medicine CME at DSMCH, Pellam, Vellore, Tamil Nadu in 2012 and at Pravara Institute of Medical Sciences, Loni at 2017. He has been organizing secretary for Medical Legal Association of Maharashtra's 22nd Annual State Conference, Pravara Forensicon in 2019. He started trendsetter moot court trials in Pravara Institute of Medical Sciences, Loni since 2016 and published a patent in February 2021 for online moot court. Now I request Dr. Pawar to deliver his lecture.
Thank you very much, ma'am, for a very elaborated introduction. So, a very good morning to all the resource person, organizing secretary, anchors, and a lovely crowd of delegates here. It's a lovely morning, maybe raining at some places of our Maharashtra. And I came to know that out of Maharashtra, delegates also joined. Considering this a very important topic, Dr. Ashutosh sir has chosen, and it is the need of every practitioner, every physician, surgeon to know the exact way of approach towards the MCCD, because Ashutosh sir has told that urban population of the medical practitioner only satisfy it to the 50% to 60%. It is more worst in the rural area, it is covered up to 30% only. What is this? The 30% of the practitioners or the deaths are filled with MCCD. So most of the information is not yet being filled in a proper way or not even reported. That has to be looked very seriously, and I really congratulate the organizing team for choosing this topic to send it across the nation and let the practitioners know its importance. At the outset, I am very thankful to the management of the DY Patil Kolhapur, the organizing team, especially Dr. Ashutosh sir, for giving me opportunity to be with you, to be amongst you. So I am here to present with the allotted session theme of medical certification of cause of death, its parts, types, and filling up the MCCD. I am bringing the greetings to all the COVID warriors, the delegates, the organizing team from the Pravara Institute of Medical Sciences, deemed to be university, and its Dr. Balasaheb Vikhe Patil, Rural Medical College, and Dr. Vithalrao Vikhe Patil, Pravara Rural Hospital. So the objectives were conveyed me to be covered are recall the concept of vital events and fatality associated with different diseases, enumerate and describe the components of death certification. We will see what are the parts, how it has to be filled. Then construct a biological plausible sequence of event in chronological order leading to death, and also identify those illnesses that were unrelated to death or merely contributing to death. So very nicely, in a lucid manner, Dr. Ashutosh sir has already covered the topic. So we are further going in details with some examples that which particular diseases are counted to be in part 1 and counted to be in part 2, to be mentioned in those particular parts and at different lines like A, B, C. So summarizing the various parts and types of death certificates. Types, you know it. 4 and 4A has already been discussed. Then explain the process of filling up the medical part of cause of death. We medical practitioners should be merely not bother about the medical part of this certificate, but entire certificate has to be filled completely. Nothing has been left incomplete, or else it will create a problem for the statistical team, which reflects into the analysis and afterward for the implementation. So though for we medical practitioners, the cause of death part of this MCCD is important, but filling every part with the same seriousness matters. And then we will demonstrate with some accurate kind of fillings for some death certificates. So with these objectives, I will be taking you to the 45 minutes of my session. So death is certainty for every birth. Every individual has to have death once he is being taken birth in the world. So the cause for every death has some cause behind its death. That's why it is we medical professionals to find out the exact cause. It may be natural, as sir has already described, or if it is an unnatural one, what sequence has led to death, what was the terminal event, what has initiated the process of death. Death is not an event, it is a process. It has started from underlying cause, and the duration may be different, maybe years, maybe months, sometimes maybe hours, or sometimes a short span of time. So the process may be lengthy, may be short, but the process has to be completely and accurately entered for the perfect statistical analysis. So let me tell you, this medical certificate of cause of death scheme was introduced in first time in the Maharashtra, that too in Pune, in 1951. Later it was extended to Nagpur in 1957, in Mumbai 1962, and in Solapur 1969. 1969 was the same year where WHO has made it compulsory. And it was the various municipalities, the municipal corporations of India, the directives issued towards the end of 1969 to bring into the effect of MCCD for certifying the cause of death under Maharashtra Municipality Act in 1965. So it was made compulsory. The region-wise, the registrar of obtaining the information for every birth and death is different. It may be Gram Panchayat officials in the rural area. It is district registrars, sub-registrars, and that one centrally it will be collected in a very regular manner in 5th of the every month, 5th day of every month, 10th day of every month at the different levels. It is a regular process. That's why every hospital, every physician has to abide with these findings. So death, if you ask what is death, so it is a process, but legally it is not being defined, though Section 46 of the Indian Penal Code states that disappearance in all its context will be considered as death, but no legal definition is there. But it is nothing but the complete and irreversible stoppage of the vital functions like circulation, the respiration, and brain functions. So this MCCD has to be issued, but by whom? It is said that Indian Medical Council Act defines who will be called as registered medical practitioner. Whoever got permanently registered in the state medical council has got the authority, the power, the right to issue the MCCD with full proof information, and that too accurately. It is the registered medical practitioner who can issue this MCCD, but he will or she will only issue after he or she has attended the deceased during the life, and not merely on the day of death or on the day when he or she has been brought in death at her hospital. So has the attended the patient in last 40 days prior to death, and he or she must be satisfied with the cause of death, then only issue. If you are not satisfied, if you have got an ambiguity, it is the mandatory thing to inform to the police. Let the police make an inquest to know the cause of death by ordering the medico-legal autopsy in those cases. So this is a process. So it is you to know the way how important the MCCD issuing phenomena is, and where to issue and where not to issue. It is not the relatives which will force you to get the MCCD. It is you to confirm all those criteria. It is the WHO, World Health Organization format, which has been implemented throughout the world for uniformity, for knowing the various aspects of types of death, causes of death behind any fatality, mortality in particular regions of the world or any particular nation. So WHO has made it uniform format, which is being applicable to all its nations. And you have seen that in the coming session, we are also going to have a very interesting and important discussion by Dr. Rajesh Bardale sir on current era of certifying it in COVID cases. So it is mandatory for every practitioner throughout the world to follow the same. And that is the uniqueness of this MCCD. As you know, it has got two types. The 4 It is meant for institutional deaths. It means that the patient has admitted to the hospital. The doctor has done his task of diagnosing, confirming by laboratory testing the disease conditions. And after his observation, if the patient dies, he has to issue the MCCD in 4 format. Form number 4. How it looks like? This is the way. What is actually there? It is the hospital inpatient, and it has got the details of the hospital, the ward number, and the all details, which is very similar to the other form of MCCD, that is 4A. The same form has to be filled without any delay, has to be informed in a regular manner so that it will be taken for statistical analysis. Then the second form is a 4A form. So 4A form is for non-institutional death. Non-institutional, it is not taking place after the admission, maybe in a broad dead case, or maybe the patient has died at home itself or any other places other than the hospital, other than the institution. It is 4A form. What is here is a non-institutional deaths, as I described. So form 4 is asking you the name of the hospital, in which ward it has been, the individual has been admitted, and what date it was. So accordingly, the 4A also has got different preamble, and here it is not asking you to mention the hospital details because it is not the admitted patient, and that's why here the details of the patient or the deceased is asked: name, son, daughter, or wife, or of which locality. The address is asked, and you have to mention from which date to which duration he or she was under treatment. So remember this: any practitioner who is not having the institutional setup also has to issue these kind of certificates, provided he know the patient, he know the disease condition, he or she has treated the deceased for some significant duration. So remember these two formats. It is not a single format, but you have to choose separately. ऐसा कहते हैं, मौत यकीनन बहुत ही खूबसूरत होगी, मौत यकीनन बहुत ही खूबसूरत होगी, जो भी मिलता है यारो, जो भी मिलता है यारो उसे, जो भी मिलता है यारो उसे जीना छोड़ देता है। तो इतनी खूबसूरत मौत है, हम लोगों ने उसे एमसीसीडी के द्वारा कंप्लीट करते हुए कोई भी गलती नहीं करना। You should not deviate yourself by providing the accurate and perfect information while filling the MCCD. So form A starts with the name of the hospital, ward, date of death. That has to be filled in a then the 4A is different in that manner. Here the deceased name is to be mentioned and address is asked. So put the address if you are very much aware about it. Get the information about this address. Then next part is the details of the deceased, because every deceased has to be reported not only with his cause of death, but also with his details like age, sex, his name. If he or she is of 5 years and few days, mention those 5 years, 2 months, 5 days. Likewise, if the neonate or the newly born baby has not even completed a month, mentioned it in a days. If it is newly born baby, if it is in hours, hours has to be mentioned. So see the importance of this age-related column. One has to be filled properly. Then this is the column where you have to mention if the age is above years or 1 month, and accordingly fill it properly. There comes the important part of the medical certificate of cause of death from we medical professionals' point of view. What it has got. If you see, it has got two parts. One is immediate cause, which part one has got immediate cause and antecedent cause, which is due to the consequence. And again, the antecedent cause is because of the another, and which is the consequence of that another cause is called as underlying cause. So underlying cause is statistically very much important, and ICD classifications highlighted, pointed out this underlying cause to know the mortality rates or the various deaths in particular locality. Part 2 completes or asks you whether the deceased has suffering from any other significant conditions or the disease condition, but which is not merely the, which is not the contributing cause in the process of death, but it has got its significance. It has not started the process of death, but it was there significantly. So, which might have resulted into the morbidity also. So see, this is the part of cause of death certificate there, which asks you the cause of death. Part 1 is there and part 2. So part 1 is the immediate cause, and it has got the another antecedent cause which is being asked. In the immediate cause, a single entry should be there, which is to be put at the A line, and then antecedent cause, which is to be mentioned in a B, which actually resulted the immediate cause. So the cause with a minimal interval will be entered at A. The process which was because of which the death has occurred has to be mentioned in antecedent cause. The antecedent cause may be because of some consequences of other cause, and which is called as the underlying cause, which is to be mentioned in C. So this all ABC lines has to be mentioned with single entries. If you are falling short of the lines, you may add the D, E like this. In cases, there may be only single entry, so one has to make a single entry. No need to enforce about adding the additional entries on your own. And as we discussed, it is the part 2 wherein the other significant condition which has not contributed to death, which has not started the process of death, but which was significantly present there, has to be mentioned separately. And very important, which usually the most of the medical professionals forgets or left it blank, is the time interval of every cause, every entry. So if you come to know, the A will have the minimal time interval, while the entry being made on C will be having maximum time interval during the process of death. So with this introduction, the cause of death is nothing but the abnormality or maybe injury or any poisoning which has contributed directly or indirectly to the death. Part 1 has to be reported as a chain of events which leads to death. Then immediate is nothing but the final cause or the complication of injury which directly caused the death. Has to be mentioned in A. There must be always a single entry in the line, and only one has to be entered there. So if you see the example, against the immediate cause, if you see right-sided pneumonia, cardiorespiratory failure, and there is / mark also. So here the multiple entries are being, which is wrong one. So single entry is expected. Any single terminal event will only lead to the death. That has to be mentioned. See here, aspiration, pneumonia, respiratory failure, refractory hyponatremia, hypertension, chronic bronchial asthma, fracture neck, femur of right side, short forms are there. Every details of the patients are there since the admission, and it is in haphazard manner. It doesn't carry any meaning there. So the earlier two columns of the cause of deaths are left blank, and septicemia and multiple organ dysfunction syndrome was mentioned as an antecedent cause. So here one has to frame the sequence of the process of death, which has started the process has to be entered at the last part, and terminal events to be entered in the immediate cause. So mode of death, very well explained. It is by means of stoppage of 3 vital functions, like if it is a brain functions, coma; if it is circulatory failure, the heart related or circulatory system related failure is there, then syncope, and respiratory system related dysfunctioning or stoppage is the asphyxia. So mode of death is always through these 3, and this should not be entered there at the line A, that is immediate cause. So see, cardiorespiratory arrest, asthenia, the respiratory failure or respiratory arrest. No, these are, every death will be leading to this only, but that has not to be entered. Asthenia, what is asthenia? You may be knowing myasthenia. Asthenia is nothing but the weakness. So it is the symptoms there, the generalized debility, the old age. These are not the things which has actually leading to death, but the specific things are to be mentioned for the purpose of statistical analysis. And cardiorespiratory arrest is a wrong way, which usually most of the practitioners are using it, and which is a wrong thing. Antecedent is underlying cause, which has leading to the immediate, and further if any sequence is there, which will be the cause. We will see one example. A patient died from an intracerebral hemorrhage caused by cerebral metastasis from a primary malignant neoplasm of the left main bronchus. So this should be entered as follows. See, the underlying cause is the squamous cell carcinoma of the left main bronchus. The primary malignant neoplasm of left main bronchus was there. So underlying cause, here the duration has to be mentioned against it. The intermediate cause or the then antecedent cause was the metastasis. Because of this, metastasis has caused, which is there in the cerebrum, and the which will further lead to the intracerebral hemorrhage. So it was the cerebral hemorrhage which was the terminal event, and that is the immediate cause. So immediate cause, antecedent cause, underlying cause. Likewise, it has to be mentioned. Part 2 is for reporting the other significant condition, but which has not started the process, but was significantly present there. Believed to have unfavorably influenced the course of the morbid process, and thus continued or contributed to the total outcome of the general disability. Intervals specifically to be mentioned. If you know the exact period, mention it. If you know it, if the relatives are telling that it is since some years, mention few years. If it is since birth, mention since birth. Likewise, if they are telling the exact period, mention it. If it is not known, then you are also helpless. You have to mention it from unknown period. They see the Mr. X was suffering from carcinoma of bronchus from last 2 years, was on treatment for chronic duodenal ulcer for last 6 months. Now he presented with complaints of severe acute pain, abdomen with guarding and rigidity since early morning. On evaluation, he reveals that peritonitis was confirmed, secondary to the duodenal ulcer perforation, which occurred 2 days before. However, he succumbed to the illness on the same day. So likewise, see the part 1 will be the peritonitis, and it was since 1 day. Antecedent cause was because of the perforation of the duodenum, which occurred 2 days back. And the perforation was the result of the long-standing duodenal ulcer, which was there since 6 months. Any entry to be made on part 2? Yes, because he was diagnosed of carcinoma of bronchus 2 years back. But it is significant disease condition, but which has not started the process. So likewise, the MCCD has to be filled. The manner of death is to be mentioned. It is in cases of the hospitalized cases in form 4, wherein the doctor knows the detailed history and every aspect he is aware about. So accordingly, the manner of death is to be mentioned, whether natural or unnatural. Then the form 4 will be asking it. Both 4 and 4A has got the requirement about the female details. If the deceased is a female, whether she was pregnant, and if the deceased was died because of the process or during the process of delivery, that information has to be provided. Then in cases of female deaths between 15 to 49, which is a reproductive age, the information about pregnancy and delivery is needed. Then the details of issuing this certificate, the medical attendant, the doctor's details are required. It is the ideal way of mentioning the name in capital letters, full name, the registration number, and a proper seal is to be put, so that if any, in case of problems, the approach can be made to the concerned individual. The last part of the MCCD is meant for next to kin or to the relatives, which carries the information about the disease and on which day the person died. It doesn't carry the cause of death details. It is useful for cremation, and it is useful to register the death on their own to the for the cremation purpose. See, so it has to be detached and to be given to the relatives so that they can have the document. And this is what we have seen for 4A, the different columns, and entirely it has to be filled considering its part as separate, what we discussed just now. Then this enables them to get the municipal permission for cremation, the last part, and the general guidelines that take the detailed case history, avoid overwriting, wrong abbreviation. You should not use any abbreviation because these are not the universally accepted, though there are a few which are only acceptable, like COVID-19. So mistakes, mode was written, abbreviation, symptoms will be, we have seen, inadequate descriptions are entered. So these short forms, IC bleed, then CKD, these are not the short forms universally accepted, and the actual columns of ABC are left and the upper gastrointestinal bleed. Then aspiration, pneumonia. So how this has to be interpreted? Urosepsis, acute kidney injury, and respiratory failure kind of things, they are not even specifically or properly mentioned. Again, the cardiorespiratory arrest is mentioned. See, here the primary bronchogenic carcinoma of right lungs, emaciation, metastasis of lobe, with a patient who had diagnosed as a carcinoma, had got a metastasis to lymph node and developed anorexia, not taking food by oral means, and then died. So is it a proper way of writing the cause of death? No. So proper way is emaciation will be the immediate cause, wherein the metastasis of the lymph node and to the liver was the result, and which has because of the primary bronchogenic carcinoma of right lung. Likewise, a known diabetic patient who had developed diabetes only after the carcinoma of the pancreas also has got chronic bronchitis since years together. He developed a gangrene foot and died. So this way it's again wrong. How it has to be mentioned? Yes, gangrene foot was the immediate terminal event. It is because of the diabetes, and diabetes was result of the carcinoma of pancreas. There was other significant condition which has not directly started the process but was significantly present, was the chronic bronchitis. So we can see a diabetic man since 15 years who was on insulin since 8 years for sugar control, developed ischemic heart disease 5 years back and now died suddenly from a myocardial infarction. This is an exercise for all the delegates, the attendees. You can try on your own. We will see how it goes. So if you see, if I considered the standing diabetes, which is because of the long-standing diabetes itself is the cause for heart conditions, then the cause of death will be like this. A MCCD has to be treated like this. The person develops myocardial infarction 1 year back. He has got a ischemic heart disease since 5 years. Because we consider diabetes as the underlying cause which has started the sequence. And if he confirms it, if he proves it, if he very much sure about it, yes, it will be there. Because the diabetes was there since 15 years. And there will be nothing to be entered in the part 2. In the same case, if the doctor confirms that the diabetes was entirely independent entity there and has not started the process of death, in that condition, myocardial infarction was the immediate cause and the antecedent cause is to be mentioned as chronic ischemic heart disease since 5 years. So here the diabetes mellitus comes to the part 2 if doctor confirms it. It is your ability of differentiating. That's why we learned which part is to be dissociated from the entire process or a club of very different disease conditions, and which is to be entered in part 1 and part 2. It is your ability and skill, which will only be developed after practice. We will see. One example I am giving, the individual with a duodenal ulcer who had got 6 months come with a pain in abdomen and had got a perforation of the duodenal diagnosed 3 days back, and 2 days back, 2 days after which he showed the guarding rigidity, fever, some set kind of his eye signs, and the person's is deteriorated. He also has got a fever, and the peritonitis was then confirmed. So you have to tell which is correct and which is wrong one. The peritonitis since 2 days, perforations of the duodenal since 2 days. So likewise, the sequence is to be mentioned. See, part 1, immediate cause is peritonitis. It was because of the perforation of duodenum. It was because of the duodenal ulcer. And see, ICD coding, the international classification of diseases, in its 11th chapter under K26.5 confirms duodenal ulcer. So likewise, every underlying cause will be traced by the statistician, and which will be helpful in implementing various health policies, and which will also distinguish the various modalities in particular areas. So nothing will be entered in the part 2. Another example is there, a person of similar kind has got a strangulated hernia on femoral region. Since 5 days, perforation of small intestine is resulted, and then again the peritonitis was the end results since last 2 days. So what happened? It is the acute peritonitis to be entered into the immediate cause, the perforation of the small intestine, and then the strangulated femoral hernia, which is explained in 11th chapter K41.3, and its duration, its time interval is to be mentioned. Part 2 again will be left blank. Then a known case of atherosclerotic heart disease and a fracture of left ischium and ilium, which occurred 6 months back, was bedridden. Afterwards shown some signs and symptoms of bronchopneumonia since last 6 days, and then succumbed to death. Which is the correct one? Bronchopneumonia, fracture of left ischium ilium, and the atherosclerotic heart disease. So see, atherosclerotic heart disease has not the disease which has started the process, but because of the fracture, the person was in a lying down position for months together, and then reduces the vital capacity and resulted into bronchopneumonia. What we called it as a hypostatic pneumonia was the end result, that is immediate cause. So now you have to tell which is right and which is wrong. You can judge it on your own. See, a known case of diabetes mellitus and hypertension since 2.5 years had fractured neck femur 1 day before, and had suddenly developed breathlessness due to pulmonary embolism, which was 12 hours before event. So is it a fractured neck femur, pulmonary embolism, diabetes mellitus, and hypertension? Part 2 is left blank. Is it correct, or the pulmonary embolism since 12 hours, fractured neck femur, which is mentioned in 19th chapter of under S72, and the diabetes mellitus and hypertension, which is again described in 5th chapter under E10.5. So the duration in first part, that is time interval, is not mentioned here. It is mentioned, and also the sequencing is being met. This is incorrect one, but while this is the correct. So likewise, you can see a lady developed puerperal sepsis after home aseptic delivery. On 6th day, after the 3 days, she had further developed urinary symptoms, which suggested acute renal failure. She was severely anemic also 2 years back, which was diagnosed. So acute renal failures, puerperal sepsis, and then severe anemia. So is it correct one, or the puerperal sepsis, anemia, and acute renal failure? If you see the duration here, duration has to be in sequence. The duration coming on the B line is maximum, which is to be entered in the last column of C. So likewise, this is the correct answer with the specification of chapter under which it is described. So this is incorrect, while this is the correct one. So hopefully I am not running late, sir. Shall I continue for another 2-3 examples? Then
Yes, sir, you can continue, sir.
please. The patient with primary bronchogenic carcinoma of right lung since 1 year shown metastasis to liver and lymph node since 6 months back. It further deteriorated the health due to anorexia and had shown emaciation 2 months back. So, primary bronchogenic carcinoma of right lung 2 months, emaciation 6 months, metastasis to liver and lymph node since 2 years. Is it right, or the emaciation, metastasis, the primary bronchogenic carcinoma? So, which is to be appreciated for correct filling of MCCD? It is the part, it is the second part here screen on the shown on the screen, which is correctly filled. See the sequence, it itself tells, and also it is very important to know the underlying cause properly so that the statistically it will be confirmed. Another one, a person with ischemic heart disease since 9 months also had cataract, was diagnosed for hypertrophy of prostate with symptoms of retention of urine since 4 days back, and later on laboratory confirmed the uremic conditions 2 days back and died then. So retention of urine with hypertrophy and uremia and the cataract was mentioned, and he also had an ischemic heart disease. Is it correct, or the uremia since 2 days, the retention of urine because of which leads to uremia? The retention was because of hypertrophy of the prostate described under this second chapter under D29 of the ICD. The part 2, which is not related, which has not been started the process, but it has been significantly presented with the condition, is the cataract and ischemic heart disease. So the second is the correct one. So likewise, these are the conditions or the various examples which we can see are to be filled. The death to be diagnosed and to be declared so that you can identify the death with a known cause, then only you are supposed to fill the MCCD. If the unnatural or doubtful cause is there, do not certify. You are not supposed to issue the MCCD without doubtful cause of death or unknown cause of death. Better to inform the police, let the police do the further process. It has to be issued immediately without delay. One should not ask for fees, should not withhold for any other demands, not to be signed in advance until and unless you have attended it, the deceased term, confirm the deceased conditions, the death, and then only you are supposed to issue it. And issuing false certificate is an offense, should be refrained from it. Medical practitioners will be penalized with ₹50 if he or she fails to issue the certificate. It is not the penalty, let me tell, but the feeling of being punished, which really matters for we noble professionalists, medical professionals. Then provide a specific cause so that the mortality will be analyzed properly. Assessment of effective public health program will be decided with your proper MCCD filling. Then these are my references. I'm thankful for the organizers, Dr. Ashutosh Poddar sir, for giving me opportunity to be with you. So as ma'am has already told, the questions will be answered in a panel discussion in the afternoon session. So with this, I'm completing the session. Hope it has reached to you. तो जाते जाते एक शेर सुना देता हूँ, मौत से डरिए नहीं, मौत भी इतनी खूबसूरत होती है, मौत भी इतनी खूबसूरत होती है, पता न था, मौत भी इतनी खूबसूरत होती है, पता न था, एहसास तो तब हुआ, जुल्फे फैलाकर कब्र पर वो मेरे जब रोने लगे. तो मौत has got his dignity, and it is our responsibility, the medical professionalists, to respect the proper filling of MCCD with the seriousness, so that the statistical analysis further will be made very much clear. So respect every depth, respect the filling of every MCCD, and do your duties with your noble approach. Thank you so much.
Thank you, sir, for explaining nicely the concept of vital events, also components of the death certification, who should issue the MCCD. You have explained nicely, sir, what are the parts of the MCCD and filling of it by giving number of examples. You have explained nicely that what should not be done while filling the MCCD by explaining with the examples. Then do's and don'ts, you have explained very nicely. Then you have made the lecture very interesting by putting Shero Shairi. Thankful to you, sir.